Determining the right test for the right patient, the right advanced imaging, the right referral is often difficult when it comes to chiropractic practice. When it comes to the shoulder, it exponentially increases in difficulty. Hey, this is Brandon Steele with ChiroUp, and I'm going to do a quick video blog on the shoulder and one new test that I think has been a game changer in my practice, and hopefully you can learn from it and use it in your practice. Unfortunately, for many tests, they have low specificities or sensitivities for the shoulder. Tests in isolation may be negative and there's still a chance they have a rotator cuff tear. Most of this is due to compensation patterns. So I get this confused a lot, but specificity is the ability of a screening test to detect a true negative. So correctly identifying people who do not have the condition. In the real world, the people who are negative do not have the pathology you're testing for. Take a healthy person without a full thickness tear. Do the test, and if they're negative, that's 100% specific. It's kind of like the coronavirus, right? Do the test, and if they don't have it, well, they probably don't have it. Now, the sensitivity is a little bit different. The sensitivity of a screening test is described as the ability of a screening test to detect a true positive rate. So, can this test correctly identify all people who have a condition? Really, that's what we want in a test, to be 100% specific and 100% sensitive. Those are called unicorns. They just don't exist. For example, weakness in the empty can test, for example, is 88 to 90% specific, but only 53 to 60% sensitive for a supraspinatus full thickness tear. So if a test is positive in the empty can, they still may or may not have a full thickness tear. If it's negative, it's negative. But they still can have weakness and pain with the empty can position, and there are still other players that could be responsible for creating that pain besides a full thickness tear. For example, it could be neurogenic inhibition. It could be compression or tension of another pain-sensitive structure. So, the presence of pain and weakness during this new test in this blog, the DIME test, when you do it in the coronal plane, it has a sensitivity of 96.3% and a negative predictive value of 96.2% for detection of a supraspinatus full thickness tear. When you include that with the external rotation lag sign and the empty can test, you can have a pretty good idea that this person has a full thickness rotator cuff tear. That does not mean that you can't treat the patient. That just means you have added information and an MRI may be indicated and a possible orthopedic referral if they are not meeting your treatment goals for both pain and functional increases. I hope this test helps. Please read the blog and don't just watch the videos. There's some increased value in that, the citations and the resource behind where we get our information from. This is a test that's helped me manage my cases with my patients a little bit better. I can sleep better at night knowing I'm giving them the right treatment for the right patient, and if they're not getting better, to move them along the tree as far as advanced imaging or referrals, then maybe someone else can help move this patient into where they want to be in life. Thanks for watching this blog. Thanks for reading the blog, and I look forward to providing more information like this in the near future.